Commissioner, Office of Support Services, Department of Corrections.
Commissioner, who's going first?
It would be Robin Bender.
Okay, Robin, go ahead, please, ma'am.
Okay, and I'm going to share my screen with you to go through our presentation. Can you all see that?
Yes, ma'am. Can you make it full screen?
Yes.
That's better.
Okay.
Okay.
So we're here today to talk about the COVID commutations. And as everyone knows, the COVID-19 pandemic has been an unprecedented international pandemic. And if we all think back to March of 2020, there was so much that we did not know about this virus or this pandemic. We didn't know exactly how it spread, but we knew it was very contagious. We didn't know how to treat it. We didn't have a vaccine for it. We developed tests for it, but we didn't have enough of those to go around. And we were seeing what was happening in other countries and other states, with many people getting very sick and people dying. We also saw what was going on in congregate settings, like prisons and nursing homes. And when the coronavirus would spread into one of those congregate settings, it spread like wildfire and it caused devastation, with many people becoming very sick and a lot of people dying. So in March of 2020, we knew we had to act quickly to take measures to protect the inmates that are in our custody. And it is the Department of Corrections' responsibility to care for those in its custody. And that is something that we take very seriously. So, in looking at everything that was going on, and with the best knowledge and the best scientific data we had at that time, we made the decision to do some commutations of nonviolent, non-sex offenders in order to save lives. And this was not only to save lives of the inmates, of course, that was part of it, but it was also to save lives for all Kentuckians, including corrections staff and the communities in which our facilities are located. Because if the virus were to spread within a facility, then it would spread among the staff and their families and out into the community. So the commutations were just one piece of our COVID response. We took a wide variety of measures, including increased sanitation, closing the prisons to visitors, and doing screenings of our staff when they would come into the facilities, as well as having increased sanitation for them when they came into the facilities so that they could disinfect their shoes and their hands and that kind of thing. So this was just one piece, these commutations. And again, this was done to save lives. This was done because of the public health crisis and to save lives. So Governor Andy Beshear issued 4 executive orders granting conditional commutations for offenders. 3 of these were done in April of 2020. The first, on April 2nd, was for prison inmates who were medically vulnerable. And those, again, were nonviolent, non-sex offenders, and ones who had CDC identified medical conditions that made them more vulnerable to severe illness or death. On April 10th, 2020, the governor commuted inmates with less than 6 months to serve. And this was done particularly to try to impact some of the crowding issues that we have predominantly in the jails, but also in the prisons, so that we would be able to implement the CDC guidelines for social distancing and quarantine and medical isolation. On April 24th, there was an additional commutation for the jail inmates who are medically vulnerable or offenders who are over the age of 65. And then on August 25th, there was a second round of commutations that was done with those who had become eligible for commutations between April and August. So this was inmates with less than 6 months to serve, prison inmates who were medically vulnerable over the age of 65 and over the age of 65. And again, all of these were screened to eliminate the violent and sex offenders. So only non-violent, non-sex offenders were released during these commutations. And the screening criteria that we used was used not only on the current crime that the offender was serving, but also on any previous sentences that were served with Kentucky DOC. So the way we looked at this and the way we determined who was non-violent and non-sex offense was we looked at all crimes that were violent by statute, all crimes that were violent by the Association of Correctional Administrators definition of violent, all sex crimes regardless of crime type, all sentences of life and life without parole. And then there was an additional search to eliminate any crimes of arson, sex, manslaughter, homicide, stalking, assault, robbery, abuse, torture, or moral practice with another. In addition, any Class B felons who had not already been excluded under this criteria was removed from the medically vulnerable list, but was kept on the list of offenders who have less than 6 months to serve. And one thing that I think has been confusing to some people during this process is that the Department of Corrections can only track the crimes for which an individual is convicted or pleads guilty to. So they cannot, the Department of Corrections has no way to track or keep track of the crime for which an individual was charged. And frankly, to do so, for DOC to take that into account on individuals' release dates would be unconstitutional, because as we all know, an individual is innocent until proven guilty. And it's only the judicial system that can determine the crime for which an individual is serving. And in that process, the prosecutor can determine to enter into a plea deal for a lesser offense than the one that is charged, and the judge has the authority to approve and accept that plea deal. So that is not something that the Department of Corrections is involved in, and it really, the Department of Corrections can only look at the crime for which an individual is serving their sentence. So I mentioned that there was a release of medically vulnerable. And again, as a reminder, the medically vulnerable were also screened to eliminate any violent or sex offenders from the commutation list. Now, we all know that as time has gone on, we've learned more about the virus, and some of the data and recommendations have changed. So in April, the CDC identified medical conditions that caused an increased risk of severe illness or death. And those conditions were things such as heart disease, lung conditions, diabetes, liver failure, kidney failure, cancer, and HIV. By August, the CDC had changed that list of conditions that cause increased vulnerability slightly. There's a lot of similarities, but there's some differences. And with each commutation, we applied the CDC list of conditions that were at that time. So in April, we applied the list that the CDC had come up with in April, and in August, when they had made changes to that list, we applied the new list of conditions that the CDC had identified by August. One of the other groups that we also provided commutations for were those who were over the age of 65, who were nonviolent, non-sex offenders, and who, who were also, we've applied this criteria of the violent crimes to screen out any violent offenders. And the reason we did this is because the CDC identified, and over time we have seen that individuals over the 65 have the highest death rate from COVID-19. And in fact, 8 out of 10 COVID-19 deaths reported in the US have been in adults 65 years and older. So the individuals who are 65 years and older who were commuted for these commutations were those who had less than 5 years to serve and were nonviolent, non-sex offenders. One of the things that's incredibly important to the Department of Corrections is to prepare those who are serving time for their release to the community and to help them become productive members of society and members of their community. So one of the biggest parts of incarceration, I mean, there are many parts of incarceration, of course, there's punishment, there's preventative steps, and then of course there's rehabilitation. And the the Office of Reentry Services within the Department of Corrections really works very hard to provide those who are being released from incarceration with the resources and the skills that they need to go back and be more productive members of society. And of course, as we all know, most of those people who are incarcerated are not going to spend their entire lives in prison. Most of them are going to be released at some point. And so we want to work very hard to provide them with the skills and resources they need. So for the individuals who were commuted during this COVID-19 pandemic, we provided, for those who were eligible, we enrolled them in Medicaid. We also worked with CHFS to allow their inmate ID to be used for assistance programs such as Medicaid and food stamps. In April, because there was so much shut down and it was so difficult to get into a doctor's appointment, we also provided those who were released, and remember, some of these are medically vulnerable individuals who had conditions, we provided them with a 90-day supply of prescription medication. And then in August, because things had begun to open up a little bit more, we provided them with a 30-day supply of prescription medication. We also provided individuals who were released with a Narcan kit and instructions for use, and with a community resource contact information and substance abuse resources as well. And that concludes my part of the presentation. And at this time, Deputy Commissioner Daly is going to provide you some additional information.
The goal of the COVID-19 related commutations was to save lives, mitigate public health impacts, and protect the community within and around our state correctional facilities. Cost avoidance was not a driving motivation for the COVID-19 related commutations. The priority was to prevent the spread of COVID-19 among inmates, staff, and the surrounding communities. Cost avoidance does not capture the cost of inaction, such as public health risks, community spread, and the impact on staff and their families. Any cost avoidance related to commutations is expected to be temporary and does not include the fixed costs the department incurs regardless of population levels. The per day cost avoidance for commutations is estimated at approximately $61,000 per day. However, it is not possible to know with certainty the amount of days these inmates would have actually served due to factors such as other forms of release and the potential for earned sentence credits.
Okay, do y'all have anything else, or is that all the information?
Yes.
Okay. We will have some questions. Do you all have any of the data as far as your numbers, where they were after the commutations, where they are now? Is the census back up to the level it was prior to COVID, or where do we stand at this point?
The population levels we're not back to full capacity. With the recent outbreaks, we need to still maintain some areas for quarantine. As of yesterday, we had approximately 10,000 in our state institutions. and 8,500 in community facilities.
Mr. Chairman,
Senator Schickel. Yes, sir.
when at the proper time, I'd like to be recognized.
Okay. I think first on the list, we have Representative Nemus.
Mr. Chairman, can you hear me?
Yes, sir. Go ahead.
Thank you, Mr. Chairman. My question is around the analysis for the release. I know we've heard a lot. I think they said about 10 times that there's no violent, non-sexual, but a number of these people who had their sentence commuted had very serious felonies. A number of them had more than 10 years to serve. We warned against this, and they did it anyway. So my question, I got a couple, if I might. My question is, none of this was discussed. What was the predicted recidivism rate? What was the acceptable recidivism rate? And looking back, when you look back, a number of these people who had their sentence commuted have recommitted heinous crimes. A couple Class A's, some Class B's, and so I'd like to ask, what was the analysis of what was the acceptable recidivism rate? Looking back, does the governor's administration view this as a successful program? Would they have done anything differently? And are they monitoring the crimes that the people that they let out of prison, some of them with 10 years or more left to serve, are they monitoring the crimes that those folks have committed?
So I'm a little bit confused about the information you provided about those. There were those who were committed who had 10 years left to serve, because we specifically looked at the medically vulnerable and those over age 65 who only had 5 years left to serve. And the individuals who were released that were within 6 months to serve, within their release date of within 6 months of their release date. So I don't, if you have names or you have information, I think we'd be interested in taking a look at that. But we certainly aren't aware of anyone who was commuted during this process who had 10 years or more left to serve.
Mr. Chairman, that data set, the spreadsheet that I'm referring to, was received by us from the Department of Corrections. It has names, it has charges, and it has time left to serve, and there are a number of them with more than 10 years. So the information I'm referring to is from the Department of Corrections. Have you guys looked at the people that you commuted to see what crimes they've been charged with since you let them out of prison early?
So there isn't a way for the Department of Corrections to track or follow the crimes that individuals have been charged with. The Department of Corrections only gets involved in this process once someone has been convicted or pled guilty and has been sentenced to serve time.
Has the Justice Cabinet review? The Department of Corrections is one department of a big cabinet. That cabinet has the Kentucky State Police. Obviously, who's been arrested. That cabinet also has in it the public defenders. They have relationships with the prosecutors. Obviously, you can contact the AOC at any time. I have the list. Why don't you have the list?
That is not information that we have. We would be happy to take a look at that information. We certainly have seen that the standard recidivism rate for people who are released from incarceration is 20% over a 1 year period. So if someone is released on September 24th of 2020, by this date, so this is 1 year later, 20% of those individuals released have been charged with or convicted of another crime. So the 1 year recidivism rate generally is 20%. The data we've seen with these commutations is that the recidivism rate is actually lower than that 20%.
The recidivism rate is actually in the mid 30% of the people that you guys have released. I have that information. I'll provide it to you. A number of those were felonies, and a couple of those were Class A felonies. So I think that information, either your information is wrong or my information is wrong. And I have my information from the administrative office of the court. So I think we have more to talk about on this issue.
I believe that the information from AOC is actually the arrest data. So it's the numbers for people who are arrested, not individuals who were convicted or have, pled guilty and are serving time. So there is
in a large part, that's because our courts have not been fully operational and we've not had an opportunity for the cases to make it through the system. I am talking about arrest data. That is true. But the arrest data shows that it's mid 30%.
And as we all know, not everyone who is arrested is convicted or pleads guilty to a crime. And even if they are convicted or they plead guilty to a crime, it may not be the same one that's charged with. And again, that is something that's determined by the judicial system and not the Justice and Public Safety Cabinet or the Department of Corrections.
Thank you, Mr. Chairman. I'll submit follow-up questions in writing.
Okay. And as a follow-up to that, we were just discussing that this issue prior to the meeting. The list that you all provided that of those who had their sentences commuted and the time that they had remaining to serve on many of those was outside the threshold of the parameters that were set. And you all brought up the notion of good time. And I had requested months ago a list of those individuals who were released who did not meet the qualifications, and you all were going to provide the amount of good time that they had that would have lessened their sentence, and I never received that. So I would once again renew that request. And again, this is all about checks and balances. The parameters were set, and the information that you all provided did not fall in many cases with offenders, did not fall within the parameters of release, and you all failed to provide. Ma'am, please quit rolling your eyes. That's very offensive.
Are you speaking to me?
Yes, ma'am. I am.
I wasn't rolling my eyes. I'm sorry.
Yes, you were. You were. But I would ask that you please.
I was not. It may have been the camera, but I was not rolling my eyes.
Okay. Please provide that information if you can. And this is a very serious issue, and we understand that the need was there to protect lives, and no one questions that. But as part of the checks and balances of government, it is our responsibility to ensure that those motions, those actions were carried out in a proper way and they were done responsibly. And that's just the way our government works. So I would ask that you all please not be offended by any of these questions. We're simply doing what we're elected to do. Senator Schickel, you have a question, sir?
Thank you, Mr. Chairman. I have a statement I want to make, and then I have a question with your indulgence.
Please proceed.
Thank you, Mr. Chairman. Representative Nemes and yourself have done a great job with your line of questioning. I have a lot of the same questions Representative Nemes did, and I appreciate his attention to detail and his hard work on this. But what I want to say is that there's just a basic difference of philosophy, I think, between our current Department of Corrections and the people of Kentucky on what their role really is. And I'll say it's not just this Department of Corrections. It was in the previous administration also, unfortunately. There's plenty of blame to go around. But, enrolling someone on our welfare rolls upon release is not most Kentuckians' idea of a productive citizen. Many would say that dependence on welfare is what got many of these persons in trouble to begin with. So I just think that's a difference in philosophy. And as I've stated on previous committee meetings, one of the things that really breaks my heart is that one of the things that inmates desperately need, and it seems like we're cutting back, is that their work experience, their work training. And our county jails cannot get inmates for their work programs. And this is one of the most important things to make an inmate a productive citizen, that they have a legitimate work experience where they have to meet expectations of interacting with the public and being polite and showing up on time and have the satisfaction of a job well done. And I just don't see these things as a priority right now in our Department of Corrections, and it breaks my heart. The victim mentality has never helped anyone, and that goes with prisoners also. Now I'm going to get to my question. I appreciate your indulgence, Mr. Chairman. My question is this: can you tell me the percentage decrease in overall population of people in custody by the Department of Corrections, and I'm talking county jails also, since COVID-19, the percentage decrease in our inmate population?
I don't have that data with me, but I'd be happy to send it to the committee.
Well, do you have the numbers?
Yes, we will, but we'll have to calculate the percentage drop.
Well, what could you share with me then the numbers of the decrease, let's say in the custody of prisoners in the Department of Corrections since the COVID outbreak, the number of prisoners less that you have in your custody?
It's about 6,000.
Out of a population of how many?
Prior to COVID, we were running about 24,000, and we're a little over 18,000 today.
So it's huge.
Yes.
Thank you.
Representative
One more
Massey.
thing.
I'm sorry, Senator.
One more thing. Just, the Department of Corrections, the Department of Corrections and Department of Justice, and the one before it also, has had an obsession with getting prisoners out of prison that the Judiciary committed to them. And I just can't help but say, and I want this to be on the record, that this COVID has been used as an excuse to reduce our prison population. Thank you.
Thank you, Senator. Can either of you address the numbers of actual COVID cases, and do you all have data that supports the success of the commutations in as far as COVID cases? Have you all analyzed that data prior to the releases and since the releases to get some kind of idea of how successful the efforts were in your view?
That is certainly not something we analyzed before the releases. I don't believe that would have been possible there would be no data for us to actually collect or analyze to do that. We have not done that since the releases either. And again, I'm not sure how we would do that. I don't know how we would analyze who would have gotten COVID but didn't. So we can certainly look into that and see if there's some information we can pull and some analysis we can do, but I just don't believe that type of analysis is necessarily possible. Okay,
but you do have numbers and trends and things of that nature in the various facilities? Have you all kept and have you all charted those numbers so we could have those?
For the state institutions, the prisons, we would have numbers of COVID, people who did come down with COVID. We have the numbers on that. We don't have those numbers necessarily for the jails.
Okay. So how many cases were there since the outbreak to date of cases, and how many deaths?
So I'll take that question. Across our 14 institutions, we have had 8,064 cases, inmate COVID cases. We lost 48 inmates, and I've lost 7 staff to COVID.
And do you all have, Commissioner, do you all have any statistics on the number of inmates that have been vaccinated to this point? Is that, where are we with that?
And as you know, this will change day to day, but as of this morning, I am sitting on 84.16% of the population across the state that have been vaccinated. And that would translate into about 1,500 right now that are unvaccinated.
And as far as the trend in the number of cases within the inmate population, are you all seeing that steadily decline, or where are we with that?
With COVID, we have a couple prisons that has a small outbreak. We had one at Western. But with the vaccinations, mask mandating, and testing capability, none of those inmates at Western was taken out to the hospital like we saw back when COVID started. While they did have some flu-like symptoms, they never rose to the cause of having to take a hospital bed or be in ICU. We have an outbreak at KCIW and a small outbreak at Southeast State right now. We have one inmate that is in the hospital, but is stable.
Okay. Thank you. Representative Massey.
Thank you, Chairman. I have a couple of questions and then a comment. With regards to these releases, when you compiled this data and made a determination of whom was going to be released, was any of this data communicated to our courts, our Commonwealth attorneys, county attorneys, et cetera?
I do not believe so. I believe that we were concerned with the time period and taking action quickly to get people out before the virus made its way into the facilities and impacted the populations that were incarcerated at that time.
Mr. Chairman, can I ask a follow-up?
Please proceed.
So with regards to that, is there a mechanism? Do you have a process in place when you go through this analysis of who's going to be released, of who should be contacted, what groups should be contacted, getting some kind of feedback from the people that had to use countless hours to incarcerate these individuals for some severe crimes? Is there any process or procedure in place to make that communication occur, or is there any data regarding that communication?
I don't believe there's any data regarding that communication, and I don't believe there's a process like you're talking about. I do know that victims who register on Divine, which is a victim notification system, that they were notified before the offender was released. So that we did provide notification through victims through our Vine system.
And then my last question is, Mr. Chairman, is it permissible?
Yes, sir.
Is the vaccine being mandated within our facilities, or is it on a voluntary basis at the inmate's discretion?
It is on a voluntary basis at the inmate's discretion.
Thank you. Thank you, Mr. Chairman.
Thank you, Representative. In relation to the budget, with the numbers, the population being decreased, what adjustments have you all made to your budget in relation to where we are right now? And as we look forward to the next biennial budget, do you anticipate your population to remain at the level it is now? Will that impact your budget? How are you all planning as you prepare for the next biennium?
Well, the population projections are currently under development by the Office of State Budget Director. But we really can't speak on what the impact will be until that analysis is done and provided to the department.
Okay, and one question I wanted to ask, and please forgive me that this is probably going to sound petty, but to me, when I saw this, it was almost ridiculous. And I don't know the medical reasoning behind this. So if there is obviously some type of legitimate medical excuse or reason or data for this, but the 30% BMI as being a guideline for releasing someone for prison, to me, that sounds absolutely ridiculous. And how did you all have inmates lining up to get their BMI tested so they could be released, or what issues or how was that addressed within the population? And I know that's a silly question, and I think it's silly that we're even discussing this in its nature, but how was it addressed within our prisons?
So the 30% BMI, again, was something that was identified by the CDC, and that's what recommendations and data we were following at that time. I do know that we didn't do any BMI testing, so my understanding is it would be somebody who in their medical record already at the time of the commutation was identified as someone who was obese with an over 30 BMI. There was no additional testing that was done to include others who weren't already identified in their medical records at that time.
Okay, and then one final follow-up that I would like to have is the information that I requested, the list of those who were commuted that you all provided. Many of those did not meet the requirement for the number of years left to serve to be released. Specifically for each one of those people, I would like a breakdown of what time was included to justify their release. And I'm going to ask this one more time, and if I do not receive it this time, I can assure you that you will be subpoenaed before the Program Review Investigations Committee to provide that information. And please understand that committee has a different level of power now, and you could be held in contempt for not providing that information. So I would ask that you all please provide that so that we may be comfortable that those who were released did fall within the parameters that were established as far as remaining time of sentence that those folks had. Do any other members have questions?
Mr. Chairman, this is Representative Beeman.
Yeah. Oh, I'm sorry. Representative Hatton, please go ahead.
Yes, I just wanted to say before we ended this meeting that I cannot imagine what difficult circumstances that all of those testifying today were operating under over the last year, and that I'd like to acknowledge the incredible amount of work that went into trying to save lives while keeping the rest of us safe, and that an awful lot of this complaining and criticism probably is in the end a very, very small part of the enormous job that had to be done. And while I'm certain that mistakes are always going to be made in decisions like this, that in other presentations, not just today from this group of people, I know how hard you worked. And also that I just wanted to say that I thought we all acknowledged we wanted to reduce the amount of people that we have incarcerated in Kentucky. It's an enormous part of our budget, and our goal should be and always has been to try and reduce that prison population. I know the jail in my districts are incredibly overcrowded, and so are all our prisons. So just wanted to say that to hopefully give a little bit of encouragement in the face of some pretty harsh and picky criticism today.
Thank you, Representative. And the criticism is really not so much geared towards those within corrections. They were following instructions that were given to them by an administration. I think the criticisms and the difference within correction is that the people that were released, many of those put our citizens at risk, and I don't think anyone can deny that. When you're letting burglars, you're letting drug dealers, it's some serious crimes. And again, we all know that many of those crimes were pled down, and these offenders were actually guilty of more serious crimes. You can justify it whatever way you want, but spending 24 years in law enforcement as an investigator for many of those years, that is the reality. And that had to be considered when these decisions were made. And I think the process in which these decisions were made was flawed. I think prosecutors, victims should have been notified. And I do understand, I think we all agree the need to save lives and to protect lives. But as with every other aspect of COVID, these decisions were made within a bubble, and the proper input was not obtained as we moved forward, nor data. And that's really the concern that we have. And as far as our prisons and our numbers, everyone agrees with that, but that can never be the priority over justice. And when we make that the priority over justice, then we are lost as a society. Representative Nemus, you have another question or comment, sir?
Thank you, Mr. Chairman. Can you hear me?
Yes.
Okay. First of all, I wanted to say I agree with Representative Hatton. Commissioner Cruz has done an excellent job. She's worked very hard. We've said that in a number of committees. My criticism, and it's very harsh, and I think perhaps not harsh enough, has nothing to do with the Department of Corrections. It goes directly to Governor Andy Beshear. These decisions were improper. They were dangerous. I am one of the leading criminal justice reformers in the House of Representatives. Everybody knows that. It bothers a lot of my colleagues that I fight so hard for criminal justice reform. But what we've done is open the prison doors, and we've allowed 1 out of every 4 prisoners to go free. Some of those prisoners had more than 10 years left to serve. Over a third of those prisoners have reoffended. Most of those are felonies. Some of those are Class A's, Class B's. This is not a small criticism, and the questions will not stop today. So they will continue. You're the chairman of the Government Oversight Committee. I'm the co-chairman. I'm going to dig into this thing much more. In addition to the information you requested, Mr. Chairman, on the particular individuals, I would like to have a list of the individuals, what they've been reoffended, what they've been recharged with. I have the global numbers. I don't have them by individual, but we need to get that information. Let me transition to my question. Now that we have Commissioner Cruz here, who I acknowledge has done a terrific job in her job as an administrator, not as a decision maker. That's Governor Andy Beshear, and all the faults are directly on him. My question now is toward healthcare. About a year and a half ago, there was an RFP that was released that had about a 7-day response time. It was a 10-year contract for healthcare for our prisons at $750 million. Because we complained, they pulled the RFP back. They redid it recently and then closed. My question is, what's the status of that RFP? I know it's been pulled back again, and we've given the incumbent provider another year of contract. I want to know why. So what's the status of the RFP, and how many providers responded to the RFP in the first place? Thank you, Mr. Chairman.
Who would like to respond?
I will. That is still open procurement, and so I really can't discuss that piece.
Who's the best person to ask those questions to?
That would be Amy Monroe.
Thank you, Commissioner. Thank you, Mr. Chairman.
Very good. Do we have any other questions? And I would anticipate that this is a topic that will be discussed further in the Oversight and Investigations Committee, newly formed Oversight and Investigations Committee, to delve into these issues a little bit deeper and the decisions that were made and that type of thing. I think we owe it to this Commonwealth to do that and to ask more questions and get more detailed information. Commissioner, Deputy Commissioner, Ms. Bender, thank you all three for being here. And I, too, want to echo your efforts are appreciated. These times have been difficult for all of us, and balance is impossible to come by through this, and very frustrating times for many of us. And obviously the efforts to save lives are appreciated. For the inmates and the staff and the communities surrounded our facility. So, and again, the struggles that we have or decisions that were made that were, for the most part, I'm certain, handed down to you all. And but know that you are appreciated and you are respected for what you do and the efforts that you make. And unless we have any other questions, I will entertain a motion to adjourn. Could I have a motion?
So moved.
Okay, we have a motion. We stand adjourned.